want to thank you for joining us and viewing this episode in the Meet the Professor series. In this month's special segment, we are featuring Dr. Lynn Eckrote, founding director of the Physician Assistant Program at Elizabethtown College. Lynn, thank you so much for being here with us today.
Thank you so much for having me.
Sure thing. Dr. Lynn, so before we begin, I kind of want to share a little bit about you, Lynn, with everybody who's going to be tuning in to watch this. So Dr. Lynn Eckrote began at Elizabethtown College in August of 2018. She earned her Bachelor of Science degree in biology from Pennsylvania State University, her master's in Physician Assistant Studies from King's College, and her doctorate in education from the University of New England. Lynn worked the majority of her clinical career in internal medicine and psychiatry prior to entering academia. She has been working in PA education for the past 7 years and has been both a clinical director and program director, and has had a program director position prior to founding the Elizabethtown Physician Assistant Program. Dedicated to providing healthcare education to future providers and ensuring that Elizabethtown's mission of Educate for Service continues in the Physician Assistant Program, Lynn maintains a focus of looking for motivation, empathy, and critical thinking skills in her students. Lynn is committed to providing students with an education that is centered on service and integrates interdisciplinary learning. Wow, Lynn, that is so very impressive. So we are just so lucky to feature her today, and I am so excited to kind of tune in and watch her as she presents about the Physician Assistant Program at Etown, and I think as a broader profession in the world right now. So Lynn, without further delay, please take us away.
Thank you so much. And again, thank you for having me. I'm excited to be here today. So I'm going to share my screen here with everybody so that we can follow along on the PowerPoint. So again, welcome. Yes, I am the founding director of the Physician Assistant Program at Etown. We are currently applying for provisional accreditation. So we're really excited about that. And we anticipate to start our very first cohort in July of 2022. And I know that seems really far away, but I'm telling you, it's creeping up quicker and quicker. So time goes by so fast. So we've established kind of a two-way pathway for students to come into the PA program. So students who are sure it's something they want to do and they've really investigated the profession for a while, and maybe they've done some courses in high school or some shadowing, or maybe just some of their life experiences have led them to the career. So they are able to apply to our pre-PA accelerated program. So those students can come right from high school and enter as first-year students into Etown's program. And they would actually complete their undergraduate bachelor's degree in 3 years instead of the traditional 4. And as long as they meet certain requirements, then they can move right into the master's portion of the program. So we have had a really big interest in this. Students like the idea of being able to get their bachelor's and master's in 5 years and then be able to work in healthcare. So we've had a lot of interest in this, and so far it's going very well. Into the accelerated program, we accept 20 students each year. So you'll hear a little bit later on, our full cohort is approved for 30 students, but we purposely have saved 10 students, seats, at least 10 each year, to have graduate students apply as well through that second pathway that I'm going to talk about. And really it helps with diversity of the classroom. So people from different backgrounds and different healthcare experiences, it really adds to the dynamic and the conversations we can have within the classroom. So that was our intention with having those 10 seats always saved for graduate students. So yes, they'll complete 3 years of undergraduate coursework, and they'll finish with their Bachelor's of Biology Health Professions concentration. So that is what our undergraduate program is based on. And that's also where we've gotten our prerequisites for all students to apply. Then they will enter the actual master's portion of the PA program, which is 26 months, traditional for PA programs. And we'll talk a little bit about what that setup looks like. So again, the undergraduate program follows this Bachelor's of Biology Health Professions concentration. And these are the courses that we require for them to complete in their undergraduate years. And this also goes for those students who are applying just to the master's portion of the program. And from wherever they've completed their bachelor's degree, they also have to have these same courses completed. So we ask for 2 classes in general biology, 2 classes anatomy and physiology, general chemistry, organic chemistry, statistics, psychology, and then microbiology, and then we recommend some other biology electives as well. So this will really give students a good foundation for them to enter the PA program and onto their graduate studies. They still have to take, their general education or core classes that we require at Etown or from whatever institution they're getting their bachelor's degree from. And at Etown, we also still have the opportunity for these undergraduate students to do signature learning experiences as well as study abroad. So students are really interested in that as well. Even though it's an accelerated program, they still get to do all of those other things that traditional undergraduate students are doing as well. So some of the options for signature learning experiences are for them to become certified nurse assistants. We have a really good relationship with Masonic Village, which is only about a mile away from campus, and they put our students through a program. This allows them to gain healthcare exposure hours and get paid at the same time. So it's a really good setup, and students really like to take advantage of this. It gives them that direct patient care, again, that helps build the foundation for their graduate studies and working with patients one-on-one in the PA program. They can also become personal care aides, EMTs. Working as a scribe is a great way to get healthcare exposure hours as well. Typically you'll find scribes in the ER, and they'll take the notes for the physicians when it's a little more hectic and the physicians or the advanced level practitioners don't have time to do it at that moment. So they keep the notes so that nothing's lost and everything is up to date with the documentation. They also have the opportunity to do biomedical research, and then there's multiple volunteer opportunities that our students have as well. So this year we did interviews. We had 6 interview dates for our accelerated students, and that because of the number of students that we're getting apply, we keep adding dates onto that. And so we've been really fortunate to be able to continue to add dates during those winter months to interview our pre-PA students. So what they do is they apply to Etown either through Common App or through the Elizabethtown College application process, and they indicate that pre-PA is their degree of choice. Then we look at those applications and we screen them because we do have requirements that they have to meet to even gain an interview. So we ask for them to have a 3.5 weighted GPA, academic GPA, and we weight it because if students are taking honors classes or AP courses or sometimes dual enrollment courses, we give them extra points for that because they deserve it and they're going above and beyond. This past year, because of COVID, we actually waived our SAT or ACT requirements, but we will bring them back this upcoming year. So we will have an SAT or ACT requirement as well. And as you can see, these were 6 of the dates that we used this past year. We're going to be doing similar dates this upcoming year. We're finalizing those dates with everybody now. We had really wanted to do in-person interviews. We were able to for the year prior where they started fall of 2020, but those students that are starting fall of 2021, we ended up doing them all virtually via Zoom, but it still worked out wonderfully and we were able to still connect with those students and have them get to know us a little bit too to make sure that Etown is the right fit for them. So we do the interviews and then we offer acceptance letters to 20 students. And if we have more than 20 applicants that we've interviewed, which we have, again, very, very good response to the accelerated program, then we offer waitlist letters as well. So if a student has decided to attend another program, then we move on to our waitlist. So the other pathway is this graduate pathway. So I mentioned that our very first cohort is going to be in July of 2022. Well, our first accelerated students started this past fall, in fall of 2020. So since it takes them 3 years to do their undergraduate coursework, they're not going to be ready yet in 2022 to enter the master's portion of the program. That means our very first cohort of all 30 students will completely be graduate students. Now, these can be students who graduated from Elizabethtown that started before we started the pre-accelerated program, so they are able to apply as long as they have the prerequisites done. Or again, any student from across the country. So there is a very high interest in PA school, but PA programs across the country are limited to how many seats that they can offer. So there's quite a number of applicants that apply for this graduate program. So we're very fortunate to have that demand, and we think we'll be very successful to have 30 in our first cohort of graduate students. We have offered Etown students, so alumni or new graduates, they get extra points on their application screening to gain an interview for acceptance. So we are giving some special preference to Etown students. We've also recently decided to do veterans preference. So students who have served in our armed forces in a medical capacity and they meet all of the prerequisite requirements, they are guaranteed an interview. So once everybody has an interview, they're basically back on the same playing field and will only go back to their grades or GRE scores if we need to do a tiebreaker. But once you're offered an interview, everybody starts fresh again and gets scored through that interview process. So those are the two groups that we are doing some special preference for. So the traditional PA program, again, similar to all PA programs across the country, is 2 years. The first year is didactic year and the second year is clinical year. So that didactic year will run straight through for a full 13 months. You do go through the summers when you're in PA school typically. And the didactic year will consist of a dedicated classroom, an assessment lab which has newly been renovated, in the Espenshade building, if any of you are familiar with that. We also have a cadaver lab that we're going to share with the biology department in Lehigh, but we will have our own cadavers and our students will do dissection of cadavers right from the beginning. So their very first summer semester, they will do head to toe cadaver anatomy during those summer months when the biology students aren't using the cadaver lab so that the PA students can have full access to it. And then we're also going to have simulation equipment. So we have a separate room for a simulation mannequin, and then there'll be additional simulation mannequins and equipment throughout the assessment lab as well. We're also going to have a virtual cadaver table, one in the assessment lab and one in the classroom, that students will be able to continue their anatomy curriculum throughout the year. So we're fortunate to be able to have that technology as well. When you talk about the clinical year, students have to have exposure to the core 7. And those core 7 rotations include family practice, pediatrics, internal medicine, behavioral medicine, emergency medicine, women's health, and surgery. Then as long as a student is in good standing in the program, they'll also have the opportunity to complete an elective rotation. And that spans almost anything. So medical specialties, surgical specialties, and subspecialties as well. So the list can go on and on. You can choose dermatology or plastic surgery or gastroenterology, urology, cardiothoracic surgery, or a student who might be really interested in one of the core 7 rotations can also request to repeat one of those rotations, but maybe in a different setting. So if their first, ER was in a more rural setting, maybe they would ask to do an emergency room rotation in a more urban setting. So we have the opportunity and the skills really from my clinical coordinator to sit down with each student on a one-on-one and kind of talk to them about their preferences, what they're looking for, what specialty they think they might want to work in, what locations would be best for them, where are they from, where do they have family that they can stay with on their rotations. So we like to say it's a big puzzle and it's a big matrix that we end up putting together when you're placing students on clinical rotations. We do have affiliations with local hospitals, Lancaster General, UPMC, Geisinger, WellSpan, but we've also expanded those opportunities as well for students to maybe have different environments in New Jersey and New York and Maryland and Delaware, and even as far as Maine. So we really want students to have a variety of environments in a variety of settings so they can get a lot of hands-on opportunity and really figure out what they want to do when they're certified and they get out to work. So I know we're going to have a little session for questions, but I did just want to touch base really quick too on the PA profession as a whole. So again, I've been a PA since 2004-ish. And again, the bulk of my career was done in clinical medicine, and then I had the opportunity to enter education. What I like to say about the PA profession is it allows students to walk through the door when opportunity knocks. So it's a very versatile profession where you can move specialties if those opportunities apply, or if it's something you're interested in seeking out. Once students graduate from an accredited program, and that includes provisional accreditation, they sit for a national exam. And that national exam stays with them for 10 years. So our profession does require a recertification exam every 10 years and some continuing medical education credits. But once you pass that initial certification exam, then that's when you can go out and work. And that test follows you everywhere. So if you move states, you don't need to take an additional test. You just need to get a medical license from that state. If you move specialties, you don't need to take another test. You get more on-the-job training than you do through a testing method. So it really is a great profession to be in, to be able to move around and have so many opportunities. The autonomy that physician assistants have now is fantastic, and we really feel like we are, there to be an extension of the provider, of the physician, and again, you'll find us everywhere. You'll find us in all types of medical specialties and subspecialties, and surgical specialties and subspecialties as well. The profession is targeted to continue to grow over the next couple of years. There has been lately a shortage of primary care physicians, and so a lot of times offices are helping with that deficit by hiring PAs to pick up that slack. And some of the state laws have changed where a physician can now supervise a larger number of PAs individually. So that has increased the profession as well. So the demand is there, the jobs are available, and we're excited to see where the profession continues to grow because things just continue to move in a positive fashion for us.
Yeah, Lynn, this was so great. Thank you so much for sharing with us. I jotted down some questions. If you wouldn't mind answering them. I'm just I'm blown away by a lot of this information. Like I knew these things were happening at Etown, but to have an insider's look that you provided is awesome. So looking at this, Lynn, and I remember going to school with some friends of mine who went on to become a physician assistant because we didn't have the program. So I guess my first question to you is, when a school doesn't have this kind of program, where does the student go if they are looking to become a physician assistant?
So the best place to find out what schools offer graduate admission is the Physician Assistant Education Association website. So it's PAEA, and you can get a list of schools there, and then you can kind of drill down which schools allow graduate applications and the certain things that they require. So we do require, we have a GPA requirement, and we are asking students to take the GRE or the MCAT standardized exam. And then we also ask for 200 hours of healthcare exposure with a minimum of 20 hours shadowing a PA. There are other schools that might have a 500 or 1,000 hour requirement. Some schools don't have a requirement at all. Some require the GRE, some do not. We also ask students to take a non-cognitive skills test called CASPER. And that really is this third-party test that is proctored through a service, and they are given a video scenario, and then students are asked open-ended questions. And the questions are there and designed to kind of have the student be rated on things such as communication and empathy, professionalism, things like that. So those non-cognitive bedside manner sort of skills that we're also really interested in. You mentioned earlier that we're really looking for those motivated students who, are here for the right reasons, and they are motivated by, the challenge and the grit. That grit is my favorite word in the whole wide world. So those grit students that are really in it for the long haul. So Casper kind of helps us with that as well, and deciding who's going to be offered an interview for acceptance.
Okay, very cool. Now, Lynn, you talked about some of the, like, you place students, they're getting placed as far as Maine, Delaware, Maryland. How do you, and this is always fascinating, I mean, even with our occupational therapy program, how do you build the relationships with these other family practitioners, hospitals, other facilities like that? How do you build those relationships?
So sometimes it's who you know, right? So if you have personal connections, we've reached out to a lot of our prior students, and they're really willing to be preceptors. It's places you used to work. Sometimes you reach out to people, so people that you've just gotten to know. And then honestly, a lot of times it's cold calling. So you're just picking up the phone or emailing people and just asking them if they take students and if they're willing to take our students. And, it's really selling the program and talking to them about what our curriculum is and that we're taking this holistic approach to medicine. And it's more than just medical knowledge, but also competencies that are required and the communication piece of it. So it's really just letting them know what we're about and seeing if, they feel our students would be a fit. Once we get students in different locations, sometimes they help us with networking as well. So if you're in the ER, but you had a case where a cardiologist came down and you really impressed that cardiologist, sometimes they reach out to us and say, we'd love to have your students, so-and-so really impressed us. And so, we'd like to be able to take your students. So sometimes things just happen. I am not above asking people I know if I see them at the baseball field or at the mall or if we're out to eat. So it's just a matter of reaching out and just getting connections however you can. Because it is difficult. There's a lot of PA schools in Pennsylvania and it continues to grow. So clinical placement sites is definitely our hardest piece. When I first came to Etown in August of 2018, I sent letters out to all of the alumni that were biology majors and had graduated essentially all like from way back when, basically just said, we're here, this is what we're planning. And I did get a nice response of people, writing back or emailing or calling and saying, yes, this is fantastic, I'd love to help. And so we've made some connections that way as well.
Lynn, very, very cool. So Lynn, with that, can you have, you talked about some great points about how beneficial the program is, not only to the medical system, but to the person themselves going into this field. What challenges do you see any challenges kind of bubbling up in the next couple years in this profession?
So, it's not a secret that COVID has changed a lot, including the way we handle medicine. So there's been a lot of more telemedicine offered to patients. So that's a technology that we're going to try to incorporate and have students experience that even in their clinical year, because we just never know when we're going to have to turn to it again. So that's definitely a challenge. Continuing using electronic medical records for students is sometimes difficult as well, because again, we go back to it's an art and it's a communication kind of aspect that you have to learn and kind of develop. So, it's really important when you're in a office setting with a patient in an exam room and that you have to take notes on your computer, that you're not just staring at the screen, right? That patient wants to know that you are listening to them and that you know what they're saying and you're paying attention. So there's definitely an art to that communication as well. So that's a challenge, just again, to teach that in addition to having the medical knowledge. It's definitely a lot of information at once, and students always say that's their hardest part of PA school. Is not the content obviously is difficult, but these students are very capable of handling the material. It's the amount of material given to them all at once.
Sure.
So a lot of times it's about time management, test taking skills, things of that nature. So we do a lot of that with our students as well. And we've already spoken to some of the services on campus, including career services, you know, and those type of services as well to kind of help with that. And the tutoring center and things like that, so that students have those opportunities to still gain some more insight, because it's different than undergrad, obviously.
Sure. Very cool. Well, Lynn, I have one more question for you, and it's all about kind of like what inspired you to go into this profession. What inspired you initially as an undergrad and a grad student, and then what's inspired you to teach at a college level now? So I guess let's start with what inspired you to be a physician assistant.
Yeah, so that's a loaded question for sure. But, you know, when I was young, I lost my dad to colon cancer when I was only 8 years old. So I think I've always kind of been immersed in the medicine and kind of being that child that wanted to save the world and wanted to be able to save people because he couldn't be. So I think that has a lot to do with just my motivation as a child and then into undergraduate. I always thought I was going to go to medical school. Like it was doctor from when I was little. I also wanted to be the first woman president in addition to being a doctor. But then as I got older, it was just medicine. So I was on that track. I was ready to go. And to be completely transparent with you, 9/11 happened. And I was kind of like, I don't want to put the time in, but I still want to be able to help. Just because at that time too, similarly to COVID, some parallels, like you just didn't know what the world was going to bring. And so family life was very important to me. Having a family and being there for my kids, future kids, was really important. But again, still being immersed in medicine is what I wanted. I felt like that's where I was supposed to be. So I always tell the story that like I woke up one night at midnight and called my mom and was like, I'm going to go to PA school. And she was like, okay, Lynn, we'll talk about this tomorrow morning. So, I applied to 2 schools and actually got into both of them on the very same day.
Wow.
I was living in the Philadelphia area at the time, but had said if I had gotten into Kings, I was going to come home. That was my home, closer to my hometown, closer to my mom. Sure. So I came home and yeah, I have never looked back. I actually absolutely love the profession. It has given me so much, both professionally and personally. It's extremely gratifying. So to get into education was one of those things for me that it was a really big way for me to pay it forward. I think even as a student sitting in class, like I was that person thinking, oh, one day I'll be a program director, I'll be in education. And so I had the opportunity to start as a clinical director and kind of jumped on it. And then had the opportunity to serve as an interim program director, and then was applied and offered the position for a full program director position, went through some reaccreditation at that program and some changes, and then decided I was going to take on the challenge of starting a brand new program. I feel that, I still have patients that I remember and that I feel I've made an impact on them and their families. But when you have students, if I have 30 students in a class, and I teach them something that they take on to every single one of their patients that they're going to see in their lifetime, that's an even bigger impact for me. So I think knowing that I can make that impact is definitely my motivator. And it's been fabulous for my family because I always say I'm a mom who happens to be a PA. I have a 14-year-old and a 10-year-old. And, I always tease them that they're very lucky they have a mom who's in both medicine and education at the same time. So, it works for us and I truly love it. And I hope to continue to do it for quite some time.
Yeah. Oh, Lynn. Well, Lynn, I can't, like I said, I can't thank you enough for joining us today. Like I said, allowing us an insider's view of your expertise and the great work that you're doing at the college. And we are so grateful to have you here. So Lynn, thank you so much again. And so we will be featuring more community members from the college in the months ahead. So don't forget to check back with us on etownalumni.com and on our various social media channels. And with that, Lynn, thanks for joining us today.
Thank you so much, Kaylee. It honestly was an honor and a privilege to be here with all of you today. And I really appreciate you asking me to do this and be able to spread the word of our developing PA program. So thank you so much, Caitlin. Thank you for what you're doing.
Thank you, Lynn.